Hello, my name is Julia Lee. I will be performing my head-to-toe assessment for the spring semester 2024 for Advanced Health Assessment with Dr. Henderson. Today is April 4th, 2024. I will start off by scanning the room. Okay. These are my supplies. This is the ground and the ceiling. Okay. I will start this exam off by saying throughout the exam I will be checking the skin assessment of the head, the face, the neck, the anterior chest, posterior chest, abdomen, upper extremities, and lower extremities. I will be checking for color, moisture, temperature, texture, turgor, edema, scarring, bruising, lesions, and nevi. I will start off by inspecting the head. The head is normal cephalic, symmetric, and midline in position. Now I'm going to palpate the head and the scalp. Hair is distributed evenly, brown in color, smooth in texture. There are no signs of swelling, tenderness, masses, lesions, infestations, or depressions. Now I'm going to move on to palpating the temporal arteries. Okay, no tenderness. Now I'm going to palpate the lymph nodes of the head and the neck. Preauricular, postauricular, occipital, tonsillar, submandibular, submental, anterior cervical, posterior cervical, and supraclavicular. Now I am going to palpate the TMJ by having the patient open and close her jaw. Okay. No subluxations, tenderness, or crepitus noted. Now I'm going to test cranial nerve number 5, trigeminal, by having the patient clench her jaw while I palpate the masseter muscle. All right. And now I'm going to test the sensory part of cranial nerve number 5 with light touch sensation by having the patient close her eyes and let me know where I'm touching.
Forehead, nose, chin, left cheek, right cheek.
Okay. Cranial nerve number 5 is intact. Now I'm going to test cranial nerve number 7, facial, by having the patient smile, frown, raise eyebrows, puffer cheeks, and pucker lips. Okay. Facial expressions were symmetric. Cranial nerve number 7 is intact. Now moving on to the ear. Upon inspection on the outer ear, the ear is appropriate in shape and position. Color is appropriate to ethnicity. There are piercings in the ear. Now I'm going to palpate the pinnae and the tragus. Okay. There are no swelling, masses, or tenderness noted. Warm to touch. Now I'm going to use the otoscope to assess the tympanic membrane as well as the auditory canal. Right ear auditory canal is clear. Tympanic membrane is pearly gray in color. Okay. Left auditory canal is clear and tympanic membrane is pearly gray in color. Now I'm going to move on to testing cranial nerve number 8, vestibulocochlear, by performing 3 different tests. I will start with the whisper test by having the patient cover the other ear and repeat what I have whispered.
August. August.
Okay. Now I'm going to use my tuning fork to perform the Weber test for testing lateralization by having the patient let me know if she can hear the sound more in the middle or in one ear more than the other.
Middle.
Okay. Now I'm going to use the tuning fork to test for the Rini test by having the patient let me know if she can hear sound 1 or 2 better.
2.
Okay.
2.
All right. Air conduction is greater than bone conduction. Cranial nerve number 8 is intact. Now I'm going to move on to inspect the eyes, the brows, the lashes, palpable fissures, sclera, and conjunctiva. Eyes are equally distanced and in symmetric, appropriate shape. Brows and lashes are full. And I want to touch. Open your eyes. Sclera and conjunctiva is white in color with no lesions or discharges. Now I'm going to test cranial nerve number 2, optic, by having the patient cover one eye and read the Snellen chart, the lowest line possible.
LTFPH.
Okay.
LTFPH.
Patient has 20/20 vision. Now I'm going to test the peripheral vision by having the patient cover one eye and tell me, and look straight ahead and tell me what number I am holding up.
2, 1, 1, 2.
Okay, now the other side.
1, 2, 1, 2.
Okay. Cranial nerve number 2 is intact. Now I'm going to test cranial nerve number 3, ocular motor, by checking the pupillary response to light. When I have you look straight ahead, I'm going to use my pen light. Okay. Pupils constricted appropriately. Pupils are equal, round, and reactive to light. Now I'm going to test for accommodation by having the patient follow my finger. Eyes accommodated appropriately. Now I'm going to test cranial nerve number 3, ocular motor, cranial nerve number 4, trochlear, and cranial nerve number 6 abducens all together by having the patient follow my finger in the 9 cardinal fields. Okay. Cranial nerve number 3, 4, and 6 are intact. Now I'm going to use the ophthalmoscope and inspect the red reflexes as well as the internal eye structure. Okay. Full red reflexes bilaterally and sharp disc margins bilaterally. Now I'm going to move on to the nose. Upon inspection, the nose is appropriate in color. There are no breaks in skin integrity. The nose is straight in midline. Now I'm going to test cranial nerve number 1, olfactory, and nasal patency together by having the patient close her eyes, occlude one nostril, and let me know what she's smelling.
Coffee.
That was right.
Coffee.
Okay. Cranial nerve number 1 and nasal patency is intact. Now we're going to move on to palpating the frontal sinuses as well as the maxillary sinuses. All right. Now I'm going to inspect the lips, the teeth, the gum, buccal mucosa, palate, under the tongue, salivary ducts, posterior pharynx, and the tonsils. I'm going to have the patient smile and open your mouth. Okay. All structures are pink and moist. There are no inflammations. 32 teeth are present. Tonsils are symmetric with no inflammation. Now I'm going to test cranial nerve number 9, glossopharyngeal, and cranial nerve number 10, vagus, together by having the patient stick out her tongue and say ah. Okay. Soft palate and uvula rise symmetrically with phonation. Cranial nerve 9 and 10 are intact. Now I'm going to test cranial nerve number 12, hypoglossal, by having the patient stick her tongue out, move it side to side and up and down. Okay. Tongue midline without fasciculations. Cranial nerve number 12 is intact. Now I'm going to move on to the neck. Upon inspection, the neck is midline in position. There are no breaks in skin integrity. Appropriate color to ethnicity. Now I'm going to palpate for the trachea. Okay. Trachea is midline. Now I'm going to palpate the thyroid gland by moving the right to the left, swallow, and the left to the right, swallow. Okay. Thyroid glands are non-visible but palpable with swallowing. And now I'm going to palpate the carotid artery. All right, now I'm going to listen with my bell at the carotid arteries. Hold your breath. No breweries were heard. Now we're going to move on to the posterior chest. I'm going to have the patient turn around. I'm going to monitor for signs and symptoms of respiratory distress. I'm going to look for use of accessory muscles, nasal flaring, tripod positioning, retraction, tachypnea, or cyanosis. None are noted. Upon inspection, there are no obvious deformities and the posterior chest is symmetric. Now I'm going to palpate for chest expansion by having the patient breathe in and out. Okay. Chest expansion is symmetric. Now I'm going to palpate for tactile fremitus by having the patient say 99.
99, 99, 99.
Okay. Tactile fremitus is symmetric. Now I am going to percuss the lung fields. Resonance heard throughout. Now I'm going to percuss for CVA tenderness. Let me know if this hurts.
No. No.
Okay, CVA tenderness is negative. Now I'm going to auscultate the posterior lung fields. Breathe in and out. Clear breath sounds heard throughout. Now I'm going to auscultate for egophony by having the patient say E.
E. E. E. E. E. E. E. E.
Egophony is negative. Now I'm going to auscultate for bronchophony by having the patient say 99.
99. 99. 99. 99. 99. 99. 99. 99.
Bronchophony is negative. Now I'm going to auscultate for whisper pectoraloquy by having the patient whisper 99. Okay. Whisper pectoraloquy is negative. Now I'm going to have the patient turn back to the front. We're going to inspect the anterior chest. Still no signs and symptoms of respiratory distress. Upon inspection, the anterior chest is symmetric. There are no obvious deformities. Now I'm going to palpate for chest expansion by having the patient breathe in and out. Chest expansion is symmetric. Now I'm going to palpate for tactile fremitus. Say 99.
99. 99. 99.
Tactile fremitus is symmetric. Now I'm going to auscultate the anterior lung fields. Breathe in and out. Clear breath sounds heard in all lung fields. Now I'm going to move to the heart. I'm going to auscultate the 5 points of the heart with my diaphragm and my bell. This is aortic, the right second intercostal space. Pulmonic, the left second intercostal space. Erb's point, the left third intercostal space. Tricuspid, the fourth left intercostal space. And mitral, the fifth midclavicular line. Fifth intercostal space, midclavicular line. Okay, with my bell, aortic, pulmonic, Erb's point, tricuspid, mitral. S1, S2 heard, no extra heart sounds or murmurs. Now I'm going to identify and palpate the PMI, which is here in the fifth intercostal space. And now I'm going to listen to the apical pulse with my bell for 1 full minute. Regular rhythm, rate is 65. Now I'm going to have the patient lie down. Okay. Raise your head at a 30 to 40 degrees angle. Okay, lay back down. No JVD or jugular pulsations present. Now I'm going to inspect. There are no lifts or heaves. Now I'm going to palpate the 5 points for any thrills. Aortic, pulmonic, Erb's point, tricuspid, mitral. No thrills present. Now I'm going to listen again to all 5 points with my diaphragm and my bell. Aortic, pulmonic, Erb's point, tricuspid, mitral. Aortic, pulmonic, Erb's point, tricuspid, mitral. S1, S2 heard, no extra heart sounds or murmurs. Now I'm going to move on to the abdomen. Upon inspection, the abdomen is flat and contour and symmetric. Now I'm going to auscultate with my bell the arteries. aortic, renal, iliac, and femoral. No bruise heard. Now I'm going to ask you to take the 4 quadrants. Right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. Okay. Normal active bowel sounds heard in all 4 quadrants. Now I'm going to palpate for any tenderness or masses. Now I'm going to percuss the 4 quadrants. Right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. Tympany heard throughout and dullness over the organs. Now I'm going to palpate for any tenderness or masses. Let me know if this hurts.
No, 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 no.
No tenderness or masses noted. Now I'm going to palpate for the liver and the spleen. Take a deep breath in and hold it. Okay. Liver and spleen are non-palpable. Now I'm going to have the patient sit up and we're going to move to the upper extremities. I'm going to inspect and palpate the joints of the hand, the wrist, the elbows, and the shoulders. Okay. Color is appropriate to ethnicity. There are no break in skin integrity. Warm to touch, no edema. There are no redness, swelling, tenderness, masses, crepitus, or nodules, and they are symmetric. Now I'm going to palpate for capillary refills. Okay, less than 3 seconds. Skin turgor. Skin is elastic, and I'm going to palpate the radial pulses. 2+ pulses. And now I'm going to move on to doing the range of motion of the fingers. Now follow me. We're going to do flex, extend, hyperextend, abduction, adduction, thumb opposition. And with the wrist, we're going to do flex, extend, hyperextend, radial deviation, ulnar deviation, rotation. Now with the elbows, flex, extend, hyperextend. Now with the shoulders, flex, extend, hyperextend, external rotation, internal rotation, adduction, abduction, circumduction. Okay, now I'm going to test the strength of the hands. Grip my fingers. Okay, 5 out of 5 strength. Now the strength of the biceps and tricep. Try to push down and pull up. Okay, 5 out of 5 strength. Now the other side. Push down, pull up. 5 out of 5 strength. Now I'm going to test the strength of the shoulder girdles. Go like this for me. Try to push in and then push out. Okay, 5 out of 5 strength. Now I'm going to test the cranial nerve number 11, accessory muscle, by having the patient shrug against resistance. Okay, cranial nerve number 11 is intact. Now I'm going to move on to doing sterignosis. I'm going to have the patient open her hands, close her eyes, and let me know what she is feeling.
Cotton ball.
So,
Cotton ball.
okay. Sterignosis is intact. Now I'm going to have a test for graphesthesia by having the patient open her hands again, close her eyes. I'm going to draw something in her hand, and I want her to tell me what it is.
R. R.
Okay, so graphesthesia is intact. Now I'm going to move on to testing cerebral coordination by having the patient touch all fingers to her thumbs, hand flip-flop, and finger to your nose, and then to my finger. Okay, cerebral coordination is intact. Now I'm going to move on to light touch sensation by having the patient close her eyes and tell me where I'm touching.
Arm. Arm. Feet. Feet.
Okay. Now I'm going to do vibratory sensation by having the patient tell me if she can feel the vibration.
Yes. Yes.
Okay.
Yes. Yes.
All right. Now I'm going to move on to the lower extremities. I'm going to inspect and palpate the toes, the ankles, the knees, and the hips. The joints are symmetric. The color is appropriate to ethnicity. There are no break in skin integrity. There are no edema present. There's no swelling, redness, tenderness, deformities, crepitus, or nodules. And the feet is cool to touch, but the rest of them are warm to touch. Now I'm going to test the capillary refills of the toes. Okay. Less than 3 seconds. I'm going to feel the dorsalis pedis pulses and the posterior tibial pulses. Okay, 2+ pulses on both structures. And now we're going to do the range of motion on the toes. I want you to flex, extend, hyperextend, abduction, adduction together. Okay, now the ankles, I want you to dorsiflex down, plantar flex up, inversion, eversion, and then rotation. Okay, now I'm going to check the strength of the ankles. Push down like the gas pedal, and then push up. Okay, 5 out of 5 strength in the ankles. Now in the knees, push out, push in. Okay, 5 out of 5 strength in the knees. Now for the hips, push in, push out. Okay, 5 out of 5 strength in the hips. Now we're going to stand up and do the range of motion of the knees, or of the hips first. We're going to flex, extend, hyperextend, internal rotation, external rotation, adduction, adduction, abduction, circumduction. Okay, now this side, flex, extend, hyperextend, internal rotation, external rotation, adduction, abduction, circumduction. And now the knee, we're going to flex, extend, hyperextend, flex, extend, hyperextend. Now I want the patient to actually sit back down so I can check the deep tendon reflexes. We're going to check the tendon reflexes of the brachioradialis, okay, of the triceps, okay, and the biceps, okay, patellar, Achilles, and then Babinski's. Okay, 2+ deep tendon reflexes. Now if I can get you to stand back up, I'm going to inspect your spine, so turn this way for me. Okay, upon inspection of the spine, there's normal and expected curvature. Now I'm going to palpate. There are no tenderness. Spine is symmetric. I want you to bend at the waist for me. Okay, there are no signs of scoliosis, so we're going to do range of motion of the lumbar spine. This is flexion, stand back up, extension, go back, hyperextension, side to side, lateral, and then twist, rotation. Now the cervical spine, look down, flex, and then back, extension, up top, hyperextension, lateral, side to side, and then rotate. All right, now we're going to face forward. We're going to do the Rumbark test. I want you to close your eyes and put your hands all the way out. Okay, no sway. Okay, you can let back down. Turn towards me. Scoot one step back. Okay, now walk towards me. Okay, now turn around. And do heel to toe. Okay, come on back. Normal gait. Now hop in one place and then the other side. All right, that concludes my head to toe assessment. Thank you.